Stroke survivors are battling against healthcare systems that are supposed to help heal them. For example, the United States spends more on healthcare per citizen than any other country in the world, but comes in almost dead last when it comes to affordability, quality of care, and performance scores compared to many other developed nations. Why is healthcare so broken, and what can you do about it? Dollars over people. While I'm sure that this will come as no surprise to you, many healthcare systems and insurance companies prioritize profits over patients. And while I'm speaking more directly to the US healthcare system because I have worked in it and been a patient all my life, I've also heard from stroke survivors around the globe that their care has been lackluster and rehab in particular has been limited to non-existent. Specifically in the United States, care and rehab have suffered, primarily because our healthcare is privatized, meaning that insurance companies have the final say, from increasing insurance costs every month to decreased visits with medical professionals. And insurance companies dictate what services patients have access to, often on the basis of cost versus what the patient actually needs. And I will give you a specific example from my own experience. I worked in home health care for several years. I received notification from my manager that occupational therapy would only be allowed 1 to 2 visits for people on a certain insurance plan. So instead of relying on a clinician's judgment, they instead say, no, hope you can get done everything that you need to get done with this person in 1 to 2 visits, and good luck with that. And insurance reimbursement rates incentivize medical facilities and healthcare practitioners to see more patients, because more patients equals more money in their pockets, even at the expense of patient care. And I'll give you a specific example. I worked in multiple skilled nursing facilities when I first started practicing. I was scheduled for upwards of 12 people a day in an 8-hour day. This led to me documenting illegally off the clock during my lunch breaks and after hours, and rehab managers often just overlooked it because it all needed to get done. And this happens because facilities made more money when I saw more patients. And this leads to a huge lack of individualized quality care. And over the last several years, there's been a huge push for something called point of care documentation. And it's basically where the therapist is encouraged to document while they're treating you. And they push this saying that it's a positive because you'll more accurately document what you're doing with your patient. But in all reality, it just lessens the quality of care that you're able to provide and a level of attention that you're able to give to each of your patients. You may have experienced this in your therapy, where you may be working on something and your therapist is on the computer documenting. What results from this? Stroke survivors are often prematurely discharged from therapy, often due to a lack of insurance reimbursement or the inability to afford private pay for therapy services. There's also a lack of lifestyle medicine intervention. And by this, I mean that practitioners often don't talk about what somebody can do to prevent a second or recurrent stroke from happening again. The focus on lifestyle factors is a huge piece that's often overlooked, especially when stroke survivors are often very anxious about what they can do to prevent another stroke from happening. Treatment versus prevention. Around 15 million people around the globe experience a stroke every year. And in the United States, 1 person has a stroke every 40 seconds. But we also know that up to 80% of strokes are preventable, according to the CDC. But making lifestyle changes is hard, and education and support from medical professionals to make these changes is severely lacking. Even if a medical professional is providing that education to someone, there is often a lack of support for follow-through and the ability for someone to make those changes sustainable. And for many healthcare systems around the world, the incentives for medical professionals are turned upside down. The focus of medical care is on treating the issues after they've already developed rather than preventing them from happening in the first place. The silver lining. For all of the reasons that I just mentioned, many therapists and medical professionals are leaving traditional care, including myself. When my grandmother had her stroke in 2019, I was completely disappointed with her lack of care and education. I found out from other survivors on support groups that our story was not unique, and that's why I started Post-Stroke. We need more resources for people who don't have access to them. Whether you're in the US and have insurance that has run out, or you're in another country where you didn't have access to good quality rehab in the first place. What you can do. I'm gonna break this down to what you can do within the broken healthcare system and what you can do outside of the system. So within the system, recognize that you are your best advocate. When you see your medical provider, ask them to break things down simply. If you don't understand something, ask questions. And before your appointment, write down all of the questions that you want to ask your provider. This will actually help you to get your questions answered and hopefully help you not forget what you want to ask. Ask your provider what you can do to prevent secondary or recurrent strokes in addition to treating your symptoms now. And ask if there are any resources available to you to help with these preventative efforts. If you're currently in therapy, before you're discharged, ask your therapist to give you rehab plans for the next several months. That way, when you go home, you're not left out on a limb, but you have a plan that's been specifically created for you to help you continue on your journey at home. And if insurance is denying continued therapy, always ask your therapist if they will write a letter of medical necessity to the insurance company. This doesn't always work, but sometimes if the therapist states why you need continued therapy, the insurance companies may approve it. If you ran out of therapy visits in the past year, when the new year starts again and your insurance benefits reset, ask your doctor to provide a referral for more therapy because your therapy visits also reset in the new year. If you feel like your medical providers or therapists are not meeting your needs and you have the ability to do so, switch providers. You deserve to have all of your healthcare needs met. Outside of the broken healthcare system, there are lots of things that you can do, including following through on your home rehab plan, doing the exercises and activities that were prescribed to you by your therapist if you got them. And although every stroke survivor is different, reach out to other survivors to see what has worked well for them. You will find excellent advice from other stroke survivors and things that you can try in your own rehab. Get involved in a stroke survivor support group, whether locally or online. This can be helpful to not only get ideas for your physical rehab, but also to feel supported in your mental and emotional health after this life-changing event. And of course, you can use resources like Post-Stroke to better understand stroke recovery and get some guidance on your home stroke rehab. All right, everyone, that's it for today. Leave me a comment and let me know, was your experience positive or negative in your healthcare system after your stroke? And I'll be leaving a link to my video, What Does Better Mean in Stroke Recovery, for you to check out. As always, if you found this video helpful, please make sure to leave it a like and subscribe to the channel if you haven't already. Make sure you hit the bell to get notifications for when I post new videos. Post-Stroke is a nonprofit, and you can help us keep our content free, either by clicking in the YouTube bar below and giving us a super thanks, by giving us a one-time donation via PayPal, or by becoming a Patreon member, in which a monthly donation gets you access to cool perks like social media shoutouts, behind-the-scenes footage, and even YouTube shoutouts, of which I have some today. And a special thank you to Heather G and Modus Nova in our Empowerer tier. We cannot do what we do without you all. Thank you all so much for watching. I'll see you next time.